So, sleep hygiene is so important for the overall quality of your sleep. And there's actually a lot that you can do during the day, and then there are things that you do at night. So, during the day, something that's really important is getting out in natural sunlight, and ideally before 10 a.m. So, around 7 to 10 a.m., getting out, going for a walk, having that natural sunlight is super important. Not being overstimulated or understimulated. So if you're stressed, you're doing too much during the day, that can impact your sleep. But also, if you were really sedentary, you didn't move enough, you didn't do anything during the day, you might be really restless at night and not really feel like you want to go to sleep. Also, consuming caffeine, and caffeine is hidden in a lot of the things we love. So, in dark chocolate and a lot of teas, but having caffeine too close to your bedtime, for a lot of people, drinking too much water right before bed too can cause frequent wakings to have to go to the restroom. And then once you get into the evening, things like winding down, having electronics out of the room, ideally charging outside of your room. Sometimes the content that people consume, so not watching something that's super stressful or distressing right before bed, having the right temperature to sleep in. Something that's interesting is a lot of what's out there about the ideal temperature, about 65 to 68 degrees. A lot of older adults find it validating that this is actually sometimes a little too cold for them. So if you want it a little warmer, that's okay, as long as it feels good to you. Not having clutter in the bedroom, just making sure it's a space that once you go into it, you actually feel relaxed and like your body is able to relax a bit and get into that zone where you can get sleepy and go to bed. And I think the most important tip often is limiting your daytime naps. If you're napping a lot, that can really cause negative issues in terms of how easily you're able to fall asleep and stay asleep. So, skipping naps or limiting them to 20 minutes and making sure they're not too close to your ideal bedtime.